Regarding the drapes and clothing, ideal clothing should be prevent airborne dispersion, an effective barrier against wet. Number two, it should be comfortable. Number three, it should be cost effective. Gown types, four types. First is standard cotton type. They are comfortable but high bacterial moist strike through. Number two is Gore-Tex, which is effective but is uncomfortable. Number three are disposable woven, non-woven gowns. These are comfortable but are expensive because small pores. Number four is body exhaust suits, negative pressure air drawn out at the head by body exhaust unit. Regarding the skin preparation, antisepsis means reduced number of viable organisms. Sterilization means complete eradication of all organisms. Antiseptic can be done in theaters by iodophores, that is iodine and betadine, 70% alcohol or chlorhexidine. Betadine affects, it's a oxidizing agent, and basically it penetrates bacteria and nucleotides and oxidize it. It has broad spectrum, bactericidal, active against bacteria, virus, and fungi, inactivated by blood, feces, and pus. 70% alcohol, it denatures and dissolves the lipid layer, and it is active against bacteria, not good against virus and fungi. Can not be used at open wounds and mucous membranes. Chlorhexidine is also broad spectrum bactericidal, inactivated by hand sanitizers, cannot use in open or mucous membranes. They are basically positively charged and bind to negatively charged cell wall and destabilizes it. Masks are used to avoid direct contamination and airborne infection, and gloves. These are some important steps. Regarding the antibiotic, these are systemic antibiotics. Single dose is important reason in preventing deep joint infection in lower limb arthroplasty. Antibiotics are given in two ways, either systemic or local. Systemic is 5 minutes before the tourniquet in knee replacement surgery, but the results are best within 2 hours of incision. No difference in 1 day or 3 day course of antibiotics. Local antibiotics are they should be heat stable. They have greater penetration. For example, gentamicin, tobramycin. MRC Ludwig trial 1982 shows 3 important factors for reducing infection lower limb. Number 1, systemic antibiotics. Number 2, body exhaust suit. Number 3, Howard ventilation.